Let me record. All right, it's recording, sharing my screen, my PowerPoint, presenting. Let me get my laser pointer. All right, you all know my name. This is my evidence-based project. It is on bradykinin hypothesis and how it impacts the pharmacotherapy, ICU admission, intubation reduction in COVID-19 patients. So here is a quick list of our agenda for today: bradykinin hypothesis, the production of it, and how it is dysregulated in COVID-19 patients. We're also going to talk about ARDS, proposed pharmacotherapy, recent and current trials of these drugs, and my overall thoughts on this topic. So according to the researchers who pioneered this bradykinin hypothesis, they said that a key to combating the pandemic is to understand the molecular basis of COVID-19 that may lead to effective treatments. So this is exactly what we're going to do. We're going to try and understand COVID-19 on a little bit on a molecular level. So bradykinin hypothesis, how it came to be. So basically, the researchers in Wuhan, China, where COVID-19 originated, harvested bronchoalveolar lavage fluid. It sounds exactly like what it is. So lung fluid separated the SARS-CoV-2, which causes the COVID-19, washed out all the extra particles. So like the capsule of the virus, they took that out just to get the genetic material, and they sequenced that. And what the researchers at Oak Ridge National Library in Tennessee did is that they plugged in the genetic material sequence of SARS-CoV-2 virus into these supercomputers, Summit and RIA, to do the data crunching to see what is dysregulated or what is wrong with the genetic material. So, in a nutshell, this is what the results are. This is the result. I know what you're thinking, super complicated, too much to understand, but I made diagrams myself to try to explain to you guys the results in a simpler way. So this is the normal bradykinin production. So just a little bit about genes. Genes basically tells our body how it should function, both physically and physiologically. So the SERPIN-G1 gene encodes for the production of C1 inhibitor, which then inhibits the factor 12, which part of the coagulation system. So if we tie this to COVID-19, if that factor 12 or F12 is as part of the coagulation system is dysregulated, we see clotting problems or even DIC as we see in COVID-19 patients. And this F12 keeps KLKB1 gene in place that encodes for bradykinin production. So far, so good, right? And let's add a little bit more. So we have in our bodies plasma kallikrein, so in our blood, and tissue kallikreins in our connective tissues, and they react or combine with high molecular weight kininogens and low molecular weight kininogens to form bradykinin. And bradykinin is produced in our bodies as part of our whole inflammatory autoimmune response. So the function of bradykinin in our bodies depends on which receptors they attach to. So we have two receptors here. We have BKRB1, or simply bradykinin receptor B1, and bradykinin receptor B2. So if bradykinin attaches to the first receptor, it causes lung injury, inflammation, and hyperpermeability. And if it attaches to the second receptor, it causes vasodilation, natriuresis, and hypotension. So before it does that, bradykinin is further converted into DABK, which is a metabolite for bradykinin, through the aid of CPN1 gene. And just a little bit more about bradykinin, ACE angiotensin converting enzyme reacts with bradykinin and basically degrades bradykinin. And let's add more to that. If you focus your attention to this left side, this is what we just discussed, this right here, and we're adding the ROS system, the renin-angiotensin aldosterone system. So we all know angiotensin 1 gets converted to angiotensin 2 by ACE, but there's also another pathway in the ROS system. This is angiotensin 1 gets converted to angiotensin 1,9 by ACE2 enzyme, and the resulting product binds to the AGTR2 receptor, which sensitizes BKRB1, which causes more lung injury, more inflammation, more hyperpermeability. So far, so good. Okay, so adding more vitamin D, we have here, we just discussed this part, and this part, now we're adding vitamin D. So vitamin D, when it attaches to VDR or vitamin D receptor, it inhibits the ROS system. And these genes right here, CYP3A4 and CYP24A1, encodes for the degradation of vitamin D. So lesser vitamin D, the whole ROS system, this right here, that sensitizes the bradykinin functions, increases. So far, so good. All right. And finally, we're going to talk about the dysregulation, or what the supercomputers or the researchers at Oak Ridge National Library in Tennessee seen with this genetic material of the SARS-CoV-2. So they found out that the SERPING1 gene is decreased 33-fold. So before we move forward, I'm just going to explain a little bit about the color code system. So if we see a blue color, it means that that molecule or gene is down-regulated. And if we see a red one, it means it's up-regulated. So if SERPING1 is down-regulated, no lesser C1 inhibitors are produced that inhibits the F12 that keeps in check KLKB1. So in turn, we're gonna have more bradykinin production. Simple, right? So a little bit more on the bradykinin dysregulation. So they found out that the ACE enzyme that degrades bradykinin is down-regulated 8-fold. So what does that mean? Low ACE enzyme, lower degradation of bradykinin, which means there's a higher bioavailability of bradykinin in our system if we ever get like infections like COVID-19. So they also found out that this BKRB1 receptors are upregulated, meaning, or more specifically, 2,945-fold. So that's a lot. So more receptors, more chances for the bradykinin to attach to them, causing lung injury, inflammation, and hyperpermeability. Further, they found out that the CPN1 gene that converts bradykinin to DABK is upregulated 671, and the second receptor is upregulated 207-fold. So more vasodilation, more natriuresis, more hypotension. Moving on, we're going to focus on the ROS part of it. So they found out that the ACE2 enzyme that converts angiotensin 1 to angiotensin 1,9 is upregulated by 199-fold. And the receptor that angiotensin 1,9 attaches to is upregulated 177-fold, which then further sensitizes the already upregulated receptor 1, which causes more lung injury, more inflammation, more hyperpermeability. So you kind of see the cascade, right? And up here, the genes that are responsible for the the degradation of vitamin D that when it attaches to its receptor that inhibits the ROS system is upregulated. So what that means is more vitamin D is degraded, so less inhibition of the ROS system. And interestingly, the vitamin D receptors are also downregulated. And moving on. So we kind of talk about like lung injury, inflammation, and hyperpermeability. So what that means exactly, as we all know, the alveolar level of the lungs, the fluid are gonna flow inside the alveoli. So hyperpermeable, so more fluid accumulates here from these capillaries, which then impairs the normal gas exchange of CO2 and O2, which presents as hypoxia or shortness of breath in COVID-19 patients, as we all know. So there's the researchers talked about bradykinin being the root cause of all the symptomology of COVID-19. But for the sake of time, I'm just gonna talk about ARDS, or acute respiratory distress syndrome. So basically it is a fluid accumulation in the lungs, which I previously explained, inflammation and hyperpermeability in the alveoli. So it is characterized by extreme low levels of oxygen, and the hallmark sign is ground glass appearance, as we can see here in the X-ray and CT. And the primary treatment is mechanical ventilation to deliver oxygen to the lungs and help the patient breathe better. And interestingly, the researchers also found out that there is an increase in hyaluronic acid in COVID-19 patients. So hyaluronic acid is produced in response to injury and inflammation. And interestingly, when it is mixed with water, which produces hyaluronic gel, which we see as the ground glass appearance inside the lungs, is like a jello-like substance, which holds more than 1,000 times its weight. So think about that. It's not just gonna affect the proper gas exchange inside the lungs here, inside the alveoli. It's also gonna be heavy for the patient. So what is that gonna do with the oxygenation? If you see like gel-like substance here, is there gonna be a proper gas exchange that helps with oxygenation? No. So furthermore, the genes that encode for the production of hyaluronic acid are all upregulated. So the HAS1, HAS2, HAS3, 9,311 fold, 493 fold, 32 fold. So it means not only are the COVID-19 patients are producing hyaluronic acid, they are producing at unbelievably high levels. And moving on to the hyaluronic acid degradation, the genes responsible for the degradation are CD44, HYL2, and HYL1. So basically they are downregulated and sometimes not even expressed. So meaning more hyaluronic acid. And here's the pharmacotherapy that is proposed by the researchers. So they said that the ideal way to stop the bradykinin dysregulation is to block both the BKBR1 and BKBR2 receptors through repurposing drugs that are already readily available in the market. So they said icatibant, which is a BKBR2 antagonist. And just a little side note, there is no currently BKBR1 antagonist, so that's unfortunate. And ecallantide, KLKB1 gene blocker, and vitamin D. They also propose vitamin D, which is a BK or bradykinin cascade suppressor. Further, just to kind of see how these drugs work. So ecallantide, it inhibits the KLKB1 gene, meaning If this is inhibited, no bradykinin production or lesser bradykinin production. And icatibant blocks the BKRB2 receptors, so no vasodilation, no natriuresis, no hypotension. And actually, Van de Verdonk and his group of researcher colleagues are one of the research teams that actually proposed the bradykinin system, bradykinin hypothesis. So they are researchers from the Netherlands. They conducted a case control study of 10 patients, and they were treated with three doses of 30 milligram icatibant sub-Q Q6H. So 9 patients were treated in the ward. So 4 patients were no longer O2 dependent within 10 to 35 hours. 5 patients substantially decreased in O2 supplementation, and 8 of the 9 patients reduced their O2 of 3 liters per minute or greater after 24 hours, and one of the 10 patients moved to the ICU. However, he or the patient still received the same treatment, and he moved back to the ward within 24 hours with high flow O2 and discharged on day 7 of hospitalization. And the researchers used 18 patients as control, and the 3 patients required spontaneous O2 supplementation of 3 liters per minute within 24 hours of hospitalization. So as we can see here, icatibant is, at least with this study only, icatibant is proven or effective in decreasing the O2 supplementation of COVID-19 patients. And currently, this is according to the National Institute of Health, United States National Library of Medicine. The trial was called I-SPY COVID-19 trial. Yes, it says it's trial, an adaptive platform trial for critically patients, I-SPY COVID. This is a trial that is sponsored by the top universities and medical facilities here in the United States. So we have the University of California, San Francisco. We have the University of Pennsylvania and Stanford Health. Currently, they're in the phase 2. I couldn't get any data from the website because it was private, but they project that the completion of the trial is the late year of, it should be 2021. Sorry about that. So yeah, it's a long way to go. And as we all know, there are vaccines that are currently, I guess, super effective. Or yeah. And for the vitamin D, just a little bit on the vitamin D. Vitamin D deficiency has been linked to higher risk of ARDS and increased viral infection susceptibility. So this is from Dancer and his group of research colleagues from the Center for Translational Inflammation and Fibrosis Research, Queen Elizabeth Hospital, University of Birmingham. So they found out that vitamin D deficiency is associated with greater bronchoalveolar lavage fluid cellular inflammation, resulting into increased permeability of the alveolar capillary barrier. And vitamin D, if we give the patient vitamin D, it's gonna more bioavailability of vitamin D is gonna attach to the receptor that inhibits the ROS system that ultimately sensitizes this part of the bradykinin system. So vitamin D, good. And this one research from Castillo, from the Reina Sofia University Hospital in Spain, they conducted a pilot randomized clinical trial. The treatment group was 50 patients, control was 26 patients, and they used calcifediol 25 hydroxy vitamin D and 0.532 milligram capsule on admission that was given to the patients. And on days 3 and 7, they received 0.266 milligram capsule, and every week until they were discharged or admitted to ICU, they also received the same capsule. So for the treatment group, 1 out of the 50 required ICU admission. There were 0 mortality, and all were discharged home without complications, which is good. And for the control group, almost 50% or 50% of the patients required ICU admission, and 2 patients actually died. Here are the other proposed drugs from the researchers: danazol, satanazol, satanazolol, Bernard, Sanzar, Hagerda. They basically have the upregulation of serpin G1 here. So more of this gene means more inhibitor, C1 inhibitor that inhibits F12 that keeps in check KLKB1, which would mean lesser or no bradykinin production. And a little bit about the hyaluronic acid that I was talking about, which turns into gel inside the lungs that can cause severe hypoxia. They propose hymochromone, which is a HAS1, HAS2, HAS3, which are genes that encodes for the production of the hyaluronic acid. So this medication basically blocks that. So I did my research, and unfortunately, there are no current trials of this drug in COVID-19 patients. So just a thought. And my final thoughts on this is that I did my paper, I've read my research. It explains, the researchers claims that the bradykinin hypothesis basically explains all the symptoms that is occurring in COVID-19 patients. So what I think is that the bradykinin hypothesis is a very appealing theory, but I'm not sure if it is currently widely accepted by the scientific community. I've never heard. It was not hyped up. I think that researchers here in the US can also gather their own lung fluid for our own analysis, just to kind of see if there is any discrepancy between our results and the genetic material that was gathered in China. And I also think that there should be, based from the very few research or trials that I presented, I think that we should do more trials to kind of test or see if icatibant or ecallantide or hymochrome or vitamin D are really, really, really effective in treating COVID-19 patients. That's it for me. I'm gonna post this video, and I'm also gonna post my paper if you wanna read that to kind of get more idea of this bradykinin hypothesis, because I couldn't fit everything in this PowerPoint. So yeah, thank you for listening. I'm gonna stop sharing my PowerPoint and stop the recording. All right.